Thanks a lot for joining us today here on KC2. This is Purpose Rwanda Show, and I am Levi Mutanganchuro. As you already know, this show intends to create a purposeful, addiction-free, and positive generation. At Purpose Rwanda, we believe that change begins with an individual, then goes to the family, the community, and the society at large. Today, we are going to discuss about the link between mental health and addiction. Joining me is Dr. Janvier Yubahwe. He's a Rwandan psychiatrist and, of course, a sexotherapist. He's currently working at Kigali Psychomedical Center and Huye Isange Rehabilitation Center. His area of interest in mental health include mood disorder, anxiety disorders, substance use disorders, and, of course, the sexual dysfunction disorders. Thank you very much, Janvier, for joining us today.
Thank you, Ravi, for your invitation.
Yes, and you already know what you're going to discuss about. It's about the link between mental health and the addiction, the link between both. Maybe to begin with, one would ask, when do we say that someone is mentally healthy?
So we can say that someone is mentally healthy when he's able to cope with the normal stressors of life. Yeah. When you are able to cope with those stressors, then you are mentally healthy. But when you fail to cope with those stressors and you are always struggling, to fix them, you are starting to have like mental health problems that can evolve to mental health disorders or handicap.
Then one would also ask, what are the causes of those mental health disorders? What are some of the challenges that affect one's mental health?
I think for now you cannot like exactly say that this is the cause of a particular mental health disorder, but according to the literature, there are multifactorial causes. The first one being genetic or biological. This means, for example, it is something that can be transmitted from a generation to another, which is linked to our genes. Another factor is like our psychological way of being. This means like our personality and how flexible our personality is. And another issue or another factor is the environment or social factors, how we interact, how we react with our environment. All of those three factors can lead to a mental health disorder.
Yes. One of the challenges that has been proved to be a challenge to one's mental health is addiction. When does one reach to a point of being mentally ill because of a given addiction? Not necessarily drugs, maybe even other addiction. When does it reach to a point when someone becomes mentally ill because of a certain addiction?
Oh, okay. So thank you for first making that difference between whether substance-related or not substance-related, because we know there are different type of addictions.
Yes.
They can be, related to substance, but also to particular behavior such as, games, internet, and so on. So it becomes then a disorder when individuals fail, to control the use of the substance or another non-substance object that they're exposed to.
Yes.
We know, for example, many people drink, for example, but they are what we call like social drinkers. Those ones, they simply drink to socialize, but they can be able to limit themselves to a certain quantity of alcohol. But there are some others who fails even, to stop when they have started drinking. So when you reach that level, when you are no longer able to control the amount of a substance consumed, when you are no longer able, for example, to be engaged properly in your professional recreation activities, when you are having this what we call craving, which is like the psychological desire of a substance, or when you start, exhibiting like some physical symptoms when you haven't taken that substance, we can simply say that you have reached the level of substance use disorder or addiction.
Yes. Do you receive those cases at Huye Isange Rehabilitation Center?
Yeah, sure. Because Sange Huye Rehabilitation Center is like a center specialized in the treatment of addictions or substance use disorders in general. So we receive many people from all category of age, young, adult persons. Yeah, we meet most of the time those cases.
What's the prevalent type of addiction that you receive at that center?
So we mainly receive people with addiction to cannabis, to heroin, and also alcohol. Those are like the main we have. But in addition to that, we may also have like people with gambling disorder, these ones who are addicted to these betting games, and on the internet also.
Okay, thank you very much. For those of you who just tuned in, we are discussing with Dr. Janvier Yubahwe, and we are discussing about the link between mental health and addiction, and this is the purpose for the show. Maybe Yubahwe, one more question that one would ask himself or herself is, how do you help these people with addiction? Because we hear of people going to these rehabilitation centers because of a given addiction, but what do you really give them to treat that addiction?
In fact, this varies from like case by case because they don't have all the same addictions. So for some particular addictions, we may use like treatment, substitution treatment. I can mention here like people with addiction to heroin. Their treatment involve like giving a substitution treatment for them to be able to tolerate to be in the center without taking that substance again. And once this phase is completed, then we pass to another phase, which is psychotherapy and psychoeducation sessions. This is trying to help them and empowering them on how they can be able to face these substances.
What then is what is the rate of recovery? Like comparing the number of cases you receive and those that recover, is the rate that high?
Yeah, in fact, that is a very nice question because sometimes people may fail, to determine whether one has recovered or not. But according to the literature, when someone is able to stay abstinent for at least 3 months, there we say that he's in a partial remission. So if someone is able to complete 12 consecutive months without taking that substance again, there we talk of full remission. So we can say that the rate of recovery is really high, but relapses are also high. Yeah. So and that is like even the nature of the addiction itself, but not related to the lack of capacity in the dealing with of those substances use disorders.
Yes, as you said it, there are those that recover for a certain given period of time, let's say 3 months or 12 months, but again go back to the same addiction. Do you have like some number of causes of that may cause one to go back to an addiction that they had quit some time back?
So we haven't done yet like kind of research to be able to identify those factors, but one that are stated by the patient themselves is to go back in the environment where he used
to the same peers.
Yeah, to the same peers that will again influence him to test again. And once he started testing, then he continues like that. And for others, it's mainly due to some social difficulties, if I can say. You can say, for example, unemployment probably. You can say some family problems. And when the person is always facing those social challenges, he may end up thinking that using a particular drug will be a solution for him.
Yes, Dr. Yubahwe, we have these cases of people who still regard people with mental health issues as people who are not in their right mind.
Yeah.
The people that go to Indera, many people know that place, and they tend to have stigma towards such people, and even themselves, they tend to have stigma to themselves. And one would ask, how do you deal with that?
In fact, like stigma is a very negative issue to address mental health problems because it somehow broke or somehow prevent people from seeking mental health services.
Yes.
So what we do most is, to try to educate people about mental health, about what the services we provide,
Yes.
and how people can be cured from those mental health problems or disorders. Yeah, by knowing that services are available, by knowing that they will be able to get help, then they start, reducing like the stigma related to mental health. Yeah.
Yes, there may be some people who are following us now, and they may think that centers don't really help as they are said to do. Which message can you give to such people who undermine the importance of or the benefits of going to a certain rehabilitation center to cure that particular addiction that they have?
I think, it's normal like to have that kind of
Thinking,
perception.
perception.
Yeah, because for example, you have sent your kid, your children, your adolescent, a friend to that center. He comes there, he passes, probably 2 months. He go back, he tries, to be resistant for additional month. But at the end of the time, under the influence of the peer pressure, this individual relapses. So even this happened, at least this person was able to function for a certain period of time,
yes.
which is also good. And despite that, he go out of the center with enough, information, with enough, abilities, to deal with the substance use disorders in the next time.
Yes. Yubahwe, you also work at this Kigali Psycho Medical Center, which is on the national level. And now that we've talked about what centers are doing, and sometimes they are not even public, at times they are even private, then what's being done on the national level to deal with mental health and this addiction?
So, talking of like the national level, we can divide this into 2 parts, for example, because at the national level, there are like institutions, for example, the Ministry of Health, the Rwanda Biomedical Center, who are in charge of, developing policies on the fight against drug, drug abuse. So they are doing what they're able to do. They have developed like different policies on that. They have also built like the centers who have been talking about to be able to help Rwandans with those problems. But there are also like health facilities at the national level that deals with those problems of substance abuse. So for them, for those centers, what we do is to really help like people suffering from addiction or substance use disorders with evidence-based approach, so that at least they can be able to stay abstinent for long. Yeah.
Yes, well said, reminding you that this is Purpose Rwanda Show, and we're discussing about the link between mental health and addictions, and we are joined by Dr. Janvier Yubahwe. Yubahwe, what are the challenges that you're still facing in this fight against mental health issues and, of course, addictions? What are those main challenges that you still face as we speak?
So the challenges, as you have said, the first challenge is still like the stigma. People get easily stigmatized when they think that they have mental health issues, or when they think of seeking for mental health services. The stigma is the first. Then the second is like the access to those mental health services, because sometimes they are the prices are somehow high.
Yes, yes.
And another issue that is also a challenge in providing mental health services is again like the shortage of mental health professionals that are qualified to give such kind of services.
Yes, well said. And as many people already know, there are a lot of policies that are in place, and there are a lot of work being done to, of course, tackle or solve these challenges that you just named. We've seen that, if I'm not mistaken, even as we speak at health center level, there are people who can treat these mental health issues, right?
Yeah. In fact, there was like a decentralization of mental health services.
Yes, services.
From the referral hospitals, the tertiary hospitals,
to the
up to the health center level, which is something that we appreciate a lot. Yeah, because now people are able to find mental health services at any level they may need or they may want. But still the challenge is, because in mental health professionals, to be able to give like comprehensive services, they need to be more than one.
Yes.
There are psychiatrists who are medical doctors specialized in mental health. There are psychologists who can follow up or provide psychoeducation and psychotherapy sessions. And there are also psychiatric nurses, social workers. So I can say it is true, the government have decentralized those services up to the lower levels, but we still need to have like the team completed.
Yes,
yeah.
yes, that's very true. And I'm sure people, the government or decision-making people are following us now, and that they got this message to do whatever possible to solve the problem of mental health issues that is now more prevalent, because now we even know the problem. In the past, the problem used to be there, but we didn't know that it's there. But now that it's there, I'm sure they are going to do whatever possible to solve these issues. There is something that you just highlighted concerning doing a follow-up, doing a follow-up to the people that you just gave these services. At the center that you work with, how do you do the follow-up, if you even do?
So the follow-up starts like from the time we discharge a patient. So you don't discharge a patient and leave it like that. You make sure that where the place where he's going, he will still, have access to a mental health professional to continue to do follow-up in kind of outpatient service. Yeah, that is one of the follow-up we do. And another follow-up we do is to ensure that the social integration is completely done, because some of the patients we have, started using these substances due to lack of social support. Yeah, and we make sure that before, for example, discharging someone, even like the package for social integration has been achieved or given.
Do you involve parents or families or friends in this process?
Yeah, sure. In fact, when I talk of social integration, it involves the family. That is the first level of intervention. But most of the time, you may find individuals, patients, who doesn't have family anymore due to the history of Rwanda that we all know. So in that case, we make sure that we are in touch with government institutions, local administrations, so that these individuals can get the social support they need.
In this process, now that it involves a lot of people, we're talking about the family, we're talking about the friends, and of course local leaders, do you put into consideration the aspect of anonymity?
Yeah, sure. In fact,
because I think it's very important.
Yeah. It is very important. So, like with every group, for example, the family, there are some issues you can discuss with them, and other issues that you cannot discuss. With local authorities, the same. And we do this, with authorization of the patient, because our services are patient-centered. We cannot, do anything
without their
against, or against the consent of the patient.
Okay, great. Then also one more question as we head to the conclusion of our show is, which message can you give to someone who may be following us right now and they are fighting a given addiction? Which message? You're a doctor, you're within these things for 9 years. The past 9 years you've been dealing with these kind of cases. Which message can you give to them, the person who is fighting a given addiction and maybe they lost hope that they can fight it and overcome it?
I think my message would be like saying that it's possible to help people with addiction or with substance use disorder.
Yes.
It is possible. And there are different services that are available to help those persons, and there are different centers with qualified professionals who can still help. The issue of addiction is not an issue to be solved by, at the individual level.
Yes.
It's an issue that needs partnership. So we are there anytime they will need us, we will help as much as we can.
And basing on your experience, there are a lot of people who recovered.
Yeah, sure. As I have said, they recover, but relapses are also a challenge. Addiction.
Yes, but I think the people who are following us don't focus on the relapses, but instead focus on those that really recovered, and may that give you hope that you can also recover. As today's topic is about the link between mental health and addiction, we can't go without talking about mental health. We've talked about it, but which message can you give to someone who still thinks that he's not mentally stable, but they fear to go to seek support? And even if you can give a message to the people around such people that tend to have stigma towards them.
So I think I cannot say that it's normal to have like stigma, but if there are some individuals who are following us and who have that kind of stigma to seek for help, I would advise them to try, to search, on internet, the different centers we have that provide mental services, pick the number for the reception, and there is always a possibility to arrange a help in kind of anonymously, if I can say.
Yes. You've heard it from the profession himself, Dr. Janvier Yubahwe, and of course this brings us to the end of our show, Purpose Rwanda. But before we conclude, if you have some departing words that you can, of course, give to our audience who are following us today, this is your time. Yeah,
I think like my message is that the substance use disorder or addiction is becoming like a public health issue, and this needs like an intervention of different levels, individual levels, family levels, and the national levels. So we are all involved in the fight against addiction, the fight against substance use disorders.
Yes, thank you very much, Dr. Janvier Yubahwe, and thanks a lot for making time. We hope that even next time when we invite you, shall of course.
Thank you, Ravi. I'm happy for this invitation, and the next time, for sure, if you invite me, I will come. I will not hesitate.
Yes, thank you very much too for your company. This marks the end of our today's show. To remind you just that in case you just didn't start with us or you want to watch even other previous episodes, you can find them on our YouTube channel, Purpose Rwanda. Don't forget to also follow us on our social media platforms, Twitter, Instagram, and Facebook, to know the different activities that Purpose Rwanda is doing to create that society, that generation that is positive, that has that positive attitude towards the different things that they do, a generation that is purpose-driven and a generation that is addiction-free. Until next time, I am Lavi Mutanganchuro. Have a good night.